Hello friends, let us now learn some important MCQs in SPM in the topic indicators of health. Which of the following is a mortality indicator? Life expectancy is a mortality indicator, whereas notification rate is a morbidity indicator. Disability adjusted life year is a disability indicator, and bed turnover ratio is a healthcare delivery indicator. Now, second question. Modified Kupuswamy scale includes all the criteria for socio-economic status except. In modified Kupuswamy scale, we have income per capita, education of head of the family, and occupation of head of the family. Income is taken per capita, not just the income of head of the family. Then next question. Expectation of life free of disability is known as Sullivan's index. Sullivan's index is also called as disability free life expectancy. In India, life expectancy is 62.6 years. In India, life expectancy is 62.6 years. Disability duration is 7.6 years. If you see, Sullivan index for India is 62.6 years minus 7.6 years, that is 55 years. Then next question. Which is the best index for burden of disease? Best index for burden of disease is disability adjusted life years is the best index for burden of disease. Which of the following is the measure of burden of disease in a defined population and effectiveness of intervention? Burden of disease in a defined population and effectiveness of intervention is disability adjusted life years. Next question. Which of the following is not a socio-economic indicator? Life expectancy at birth is not a socio-economic indicator. Socio-economic indicators are given by the mnemonic he flagged. They include housing, family size, literacy rate, available per capita calorie, GNP per capita, growth rate, unemployment level, and dependency ratio are socio-economic indicators. Life expectancy at birth is not a socio-economic indicator. Then, next question. Sullivan's index is life free of disability. Virulence of the disease is indicated by case fatality rate. Case fatality rate indicates the virulence of the disease. All of the following indicators are used to measure disability rates in a community except Human Poverty Index. See, in the given options, Sullivan's Index, Health Adjusted Life Expectancy, Disability Adjusted Life Expectancy are the disability indicators. Other disability indicators are Health Adjusted Life Expectancy, Quality Adjusted Life Years, Disability Adjusted Life Year, Sullivan's Index. All these are the disability indicators. Next. Which of the following is true about disability adjusted life years? Disability adjusted life years includes life lost to premature death and years lived with disability adjusted for severity of disability. See, in the first option, life is adjusted for disease. Yes, life is adjusted for disease, but this includes both A and B. Like premature death is adjusted for disability, life expectancy free of disability. See, all these options are correct, but the best option among all those are years lost to premature death and years lived with disability adjusted for severity of disability. Okay, next. Burden of the disease is given by proportional mortality rate. Remember, virulence of the disease is indicated by case fatality rate, whereas burden of the disease is given by proportional mortality rate. Then, next question. In a village with population of 5,000, 50 people have a disease and 10 of them died. Then case fatality rate is equal to case fatality rate is equal to number of people died due to disease by total number of people suffering from the disease into 100. Here 10 people died. So 10 by people suffering from the disease is 50. 10 by 50 into 100, which is 20%. So see, case fatality rate is equal to number of deaths due to disease by total number of cases due to disease into 100. Number of deaths due to disease is 10, whereas total number of cases due to disease is 50. So total we have 10 by 50 into 100, that is equal to 20%. Next question. Best indicator of availability, utilization and effectiveness of health services is infant mortality rate. Best indicator of availability, utilization and effectiveness of health services is infant mortality rate. One disability adjusted life years signifies one lost year of healthy life. One disability adjusted life years signifies one lost year of healthy life. Disability adjusted life years nowadays is replaced by health adjusted life years. It is replaced by health adjusted life years. That is, number of years in full health a newborn is expected to live based on current rates of ill health and mortality is health adjusted life years. So 44, next question. 50 people are suffering from cholera in a population of 5,000. Out of 50 suffering from cholera, 10 died, but the total deaths are 50. What is the death rate? Death rate is the number of people died by total number of population. Here, death rate is total number of deaths by total number of population. Here there are 50 deaths and the total population is 5,000. So 50 by 5,000 is 10 per 1,000. So the answer is death rate is equal to total number of deaths by total population. 50 deaths are seen per 5,000 population. That is 10 deaths per 1,000 population. Next question. Communicability of a disease is assessed by secondary attack rate. Communicability of a disease is assessed by secondary attack rate. Secondary attack rate is the number of people to which a disease spreads, the number of susceptible individuals to which the disease spreads from the first primary case is secondary attack rate. Next question. Sullivan's index measures life expectancy adjusted without disability or free of disability. Measures life expectancy adjusted without disability or free of disability is Sullivan's index. Next question. Health indicators are used for health status of community. Health indicators are used for knowing the health status of community. The expectation of life free of disability is known as Sullivan's Index. Expectation of life free of disability is known as Sullivan's Index. This is direct one-liner. Disability, DALY, is disability adjusted life years. Which of the following is the best to compare the vital statistics of countries? To compare the vital statistics of countries, we will have to use age standardized death rate. It's quite simple. Crude death rates and crude birth rates, this is not age standardized. Okay, if it is age standardized, then it can be used for comparing different countries. Next question. Most important health indicator of a country is? The most important health indicator of a country is infant mortality rate is the most important health indicator of a country. Silent epidemic of the century is Alzheimer's disease. Alzheimer's disease is the silent epidemic of the century. Thank you guys for watching my lecture. Thank you.